All right. So typically, I don't have a special guest on the weekly Wednesday call. It's typically reserved for just clients, and as you guys know, just teach a lecture and have a Q&A at the end. But I wanted to bring a special guest on today, and his name is Brandon Valent. He is the owner of Ascend Health and Wellness. He is a physician assistant, and he owns his own company, Ascend Health and Wellness. Me and Brandon met back during the COVID times, 2020. I was doing a show. He was doing a show. We were both coached by the same individual. We were teammates, and that's kind of how we linked up. And really, we've been really good friends ever since, going on about 5 years. So, kind of as my business has rolled, kind of to where it has been, Brandon kind of rolled into his own, niche, own space, and has really, taken off with what he does. And that's why, not because he's a good friend of mine, but the work that he does, I try to, not push anybody to work with him. But if you need help, have any kind of issues, I highly recommend that you reach out to Brandon. But outside of that, I think that's probably the best introduction that I can give him. Besides, he's a great bodybuilder, a great friend, and yeah, I'm excited to hear what he has to say today. So, Brandon, the floor is yours, brother.
I appreciate it, Austin. I'm not gonna lie, I'm a shoot from the hip guy, so I never like have anything set up or like kind of like ready to say, but for like a little background on myself, like Austin said, um, bodybuilder as a hobby for many years now. First competed back in 2019 and then met Austin a year later. We're being coached by the same guy. Have been good friends ever since. I've been practicing medicine for over 10 years now. I started out in psychiatry, actually, and then moved into emergency medicine. Did some men's health for a little while for like kind of one of your standard cookie cutter type practices. And that's what kind of like drove me to, start educating myself more on like hormones, nutrition, weight loss, and some of the things that I really specialize in now, as well as primary care and a lot of things that go under recognized or there's not a lot of importance emphasized in like a primary care community for people who are athletes or have a bodybuilding background or powerlifting, and use any type of whether they're natural athletes or exogenous substances. There's not a lot of providers out there that help those types of populations, and so I knew that I had a passion there, and I could kind of create my own niche in that community. And so that's what inspired me to open up my own medical practice back in 2022. I started part-time for the first year and just grinded it out between that and two other part-time jobs and went full-time with my own practice. And it's been 2 years exactly now. And so I'm the sole owner and medical provider of Ascend Health and Wellness, specialize in really hormones, nutrition, weight loss, training, supplementation. Um, I think I spend most of my time like reading literature when it comes to like physiology, hypertrophy training. But I try not to stay too focused on one area, so that I can help a variety of people, men and women, any age. I've seen, men as young as 20 dealing with low testosterone, from like some pretty rare conditions to, like men over the age of 65, and women everywhere in between, whether it's, PCOS, early 30s, perimenopause, postmenopausal, helping people feel better ultimately when they hit a certain stage in life where we all kind of naturally decline when it comes to uh, hormone um, hormone function in general. And so I love what I do. I can't say, like I can't say that enough. Like it is a passion of mine, and then I like being able to integrate, physical fitness on top of that because I think that it goes a long way in helping people in the long run, like understand that they have their own, like you have power over essentially like how you feel, like, and it ultimately always comes down to lifestyle, integration of healthy habits, and not there's like Austin will tell you, and a lot of his clients, there's never like a one size fits all, and that's part of what you run into with coaching is figuring out how you have to reach that one person. Everybody's different, everybody responds differently, and so that's one thing that I've definitely recognized over the years of treating people, and I think will keep me moving forward, because no one person is exactly the same, and everybody requires something different. And at the end of the day, if you listen to somebody, I mean, honestly, they tell you the answer, but you have to know what questions to ask. Um, and so keeping people healthy, keeping people safe, keeping people optimal, quote unquote, which, like we can get into, some of the more specific nuances with like hormone ratios and stuff like that, and like how that changes over time and what might be good for one person is not good for another. But educating my patients on that and helping them figure out what's going to be like the best solution for them. Uh, yeah, that's primarily like myself and my practice in a nutshell. I have not been competitive bodybuilding for the last 3 years because I tore my patella tendon back in 2022 or 20. My last show was 2022, June, same show that I'm going to be doing in 3 weeks. And then about 6 months later, ruptured a patella tendon, was in a straight leg brace for 3 months. Probably the roughest injury that I've been through, and have been kind of like slowly recovering from that over time, getting my body back to, just what I like to consider optimal and functional. Um, and I figured I'd give it one more hoorah, as far as seeing if I could leave my best effort on stage this year before I've got a little girl due in September. So life will change after that. As anybody with kids knows that it does. Uh, but yeah, I love the process. I love the hobby. I love the people that I've met over the years. Um, and I will want to continue doing what I'm doing for, many years to come, as long as I can. So thankfully I've built a really good foundation, I think, of people that do trust me. And so that kind of helps me grow and helps other people grow, just by kind of like word of mouth, essentially. It's just myself as the sole provider and owner for the practice. I've got one person that helps me at the front desk. Her name's Jessica. And then I just hired a nurse who's also a bodybuilder. And so she's going to be coming on board to help me as far as just, all of the patients that, like I need to take care of on a daily basis, coordinating their care to the best of our ability, making sure our communication is, top notch and bar none, and we continue to do right by the people that we provide care for. So really, I'm an open book. I always like to admit what I know and what I don't know. I'm definitely not afraid at this point in my career to say I don't know something. Um, but that's also, I think, part of the job as like a medical ethical professional, is you refer to somebody that does know if you don't know. But I am any Q&A, essentially any questions that you have when it comes to hormones, nutrition, supplementation, whether it's over the counter, exogenous supplements, recovery, training, volume, intensity, like a lot of the stuff that I'm sure Austin preaches, like every week. I like to think I have a pretty firm grasp on. And then, of course, my own personal experience. Anything that you got as far as questions go, don't hesitate to ask, and, I'll kind of just work through one step at a time. If you have anything that you came on here for, anything that's personally related to you, anybody that you know that's struggling with anything, the more insight and education I can provide, to help give somebody solutions, that's why I'm here today.
Well, cool deal. I guess what we'll do is, um, w- I don't know if Brandon has anything planned as far as like anything that he's going to talk about specific, or if you guys have a ton of questions about really just kind of anything in general that he talked about, we could definitely just dive into those. I do want to be respectful of his time, so maybe 15 or 20 minutes. It's typically we normally push these until one, right? But before we kind of dive into anything specific, does anybody got any particular questions for Brandon or anything that that you come here to specifically ask? Anything at all?
Hey guys, this is Dante. I did have one question that I've been researching for past couple of weeks, and that resolves around genetic testing, like methylation testing, gene
Yeah.
testing, so to speak. So I wanted to see, is that worth the cost to have that done? From my research, it just seems like anything that your body may be naturally deficient in, it could kind of point those out, and then for the supplement side of things, you can kind of have a better idea of what you're trying to target and what supplements you should take in order to get your body to its most optimal performance.
Yeah, it's a great question, Dante. So I actually get that question pretty often. I'm not sure if there was a specific gene test that you were looking at. I know one of the more common ones out there is like the 10X, like Gary Brecka kind of promotes that a lot. There's definitely more cost-effective testing out there, but like just for example, like methylation and like folate deficiency and things of that nature. Like those things in particular are important for knowing like your foundation as far as if you're a reduced folic acid converter, because you have you can be heterozygous for an allele or you can be homozygous. So you can have, you absolutely have to have supplementation with L-methylfolate in order to help optimize like all of your metabolic functions depending on where your genes sit, right? And so like that in particular, we used a lot in the past with psychiatry, for example, because the pharmacodynamics and kinetics of medications and the way that they're metabolized do change based on how you how you produce or turn over methylfolate. And so when it comes to like any other supplementation, there's not, from what I've seen, a lot of great research out there that clinically correlates. Like, so you come back with this 10x test, right? And I know that they are unreasonably expensive. I don't know if it was like $700, $800 or more or something like that. Um, I, I'm a firm believer that any information can be useful. But then there's people who, like say it's all useful and there's no research to like support that. Like for example, in my opinion, Gary Brecka puts like a lot of stuff out there that is more like a marketing advertising kind of thing to like make money, in my opinion. Just because like I'm an evidence-based medicine guy, which means, we look at we essentially look at randomized control trials preferred as like the gold standard to say this is going to be a causative effect for this result versus a correlative effect. Correlation meaning like it might be related, but it doesn't mean it's causing one thing versus another. And so I think you get a lot of that with genetic testing out there, save for specific testing for like drug mechanisms. So when you look at like the supplementation for like the 10X, I've seen multiple, and I'd have to pull up a couple patient documents to remember exactly what it goes through. But at the end of the day, I think like what I always want to drive home to people is like a supplement is a supplement. Right? A supplement is supposed to help supplement, like an already healthy lifestyle if we're naturally deficient in it because of a reduced gene to convert, folic acid, for example. Or like, there are things called intrinsic anemia where your body literally cannot digest B12 and you have to do B12 injections. It doesn't matter how much meat that you eat, like your body's just not going to absorb like that nutrient in particular. So there's certain areas where it's relevant and a lot of areas where it's not. So what I always tell patients is, yeah, I mean, if it's not a monetary constraint for you and you want the information, go ahead, get it done. Like I'll help you kind of read it, I'll help you analyze it. And I would still go based off of the foundation of what does your lifestyle look like? How are your nutrition habits? How's your sleeping? How's your exercise? Where are we deficient there, where like some of these things could actually improve naturally versus adding a supplement? Because like a lot of people are iron deficient, right? And so they will have low ferritin levels. And so that could be for a variety of reasons. A lot of the time, it's not actually because they're not eating enough meat, but they might not be getting enough vitamin C to help with the iron absorption. Or they have certain, like underlying GI, IBS kind of disease where, part of their duodenum or their stomach is just not absorbing certain nutrients. There are a lot of multivitamins out there where like you put all of this stuff in one thing. And I'll tell you too, from lots of research that I've seen over the years, a multivitamin has never been shown to decrease morbidity or mortality. So like the risk of disease or cause of death. Right. And a lot of the things that you get in a multivitamin are actually going to interact with the same receptors. So you can't absorb everything in there. So very long, essentially just um, very long answer to relatively simple question. If you have the money and you want to see the data behind it, just to have like a number at baseline, go ahead and get it done if it's not like a monetary constraint for you. But if it is a significant monetary constraint, like I would go based off of your symptoms, probably some more cost-effective testing as far as like essential minerals and vitamins. Like hair follicle testing is actually not that expensive, for example. And you can see like kind of like a 3-month course of, like what you're absorbing, what you might be deficient in. There are certain serum blood tests that you can check for like intracellular, extracellular magnesium, for example, to see if you're actually deficient there, which most people are not. But so always address like the lifestyle first and foremost. See what you can fix there from a foundational standpoint. Talk to a medical provider about some of the issues that you might be going through that give you concerns for being deficient in certain areas, and then see if it's relevant for you to actually get it tested in that way, or if there's something more cost effective to do. If that answers your question. I'm sorry. I know that was very long, but I tend to be wordy and lengthy in
No,
response.
no, actually, perfect. I do appreciate your time for answering that.
Yeah, absolutely, man.
So I've got a question.
Sure.
Whenever really two. So I guess whenever it comes to like natural athletes and like competing like on the stage,
Yeah.
I'm just curious to know what your experience has been with their testosterone levels reacting to getting that lean.
Oh,
Because there's like stuff out there, obviously, about like sometimes it's better to do it enhanced or not, just because of like how tough it is on your body.
yeah.
Um, and then my other question is as far as your clinic goes, are you like do you offer telehealth as well
Yeah, yeah,
in
we
that
offer
regard?
telehealth. So within medical, there's a lot of unfortunate red tape along medical practice. Like I have to be licensed in whatever state you're living in order to see you clinically as a patient. But so right now we're licensed in North Carolina, South Carolina, and just got licensed in Florida. Like we'll potentially be looking to expand past that in the future. It's just a pain in the ass, excuse my language,
Right.
because every state that I'm licensed in, I have to have another supervising physician that's also licensed in that state, which is a monetary constraint to a certain degree. We have to have DEA. We have to have like a lease where like we have a virtual office in each state. It's a pain. Um, but yeah, we do in-person and telehealth. Natural athletes, I actually have quite a lot of experience with. I have never seen a natural athlete get close to stage, and I mean like close within 2 to 4 weeks, and their test levels not be low, or not be significantly lower than they were than when they started. And that does not matter as far as like what nutritional like program like we put them on. I've taken one or two natural athletes to stage before. And I mean the leaner you are, I mean the lower your test is going to get, the more dysregulated your thyroid function is most likely going to be. It doesn't seem to matter if you manipulate fat and you keep fat relatively high for normal healthy, like hormone function, which men don't require as much as women. But the only way, I can't say that there's definitely I've never seen any literature that shows you can guarantee, somebody stay in what's called a eugonatal state as a natural athlete and get that lean, like talking like, 5 to 7% stage lean. But it does come back. And you can preserve muscle mass, with an appropriate nutrition plan. Because I mean, as long as you have, and there's data on this too, like preferably with a natural athlete, you're going as high as 3 grams per kilogram of body weight with protein consumption, higher if you can. And that in combination with resistance training, like we'll say like a 1 to 2 RIR at least twice a week for each body group, you're going to maintain as much muscle mass as naturally possible. Yeah, and it probably maybe it doesn't go without saying, but when you're a supplemented athlete and your testosterone levels are higher, or you're using any other exogenous substances, your ability to retain more muscle mass is significantly higher for sure. It has nothing, I will tell you though, like from what I've seen on a research standpoint and subjectively myself, objectively with, people that I've taken to stage, um, it does not change the rate of fat loss by any means. Like ultimately, that comes down to energy expenditure. So now, it can be a little bit more complex when you're later in life, essentially. Like for women who are perimenopausal, postmenopausal, men who are hypogonadal, low testosterone levels. What you do see with people over time is when those levels naturally decrease, you will absolutely, regardless of weight training, nutrition supplementation, you will start to lose lean mass around like your limbs for the most part and gain central adiposity as well as visceral adiposity. So like the fat mass around your organs, which is not good. So, and like, there's actually literature on that with men with too low of estrogen levels and too high of estrogen levels. So there's kind of like there's a ratio that we try to, get people to as close to as possible, but that ratio is not written in stone by any means. Some men seem to function a lot better with a estrogen level of like 30 to 50 picograms per milliliter, or it could be as high as 100, which is over double the normal limit depending on their testosterone ratio. And they might not have any symptoms.
Gotcha.
So everybody's different though. But yeah, it is I've never seen anybody not tank their testosterone levels as a natural athlete close to stage.
Gotcha.
And when I
Appreciate
say tank, it doesn't mean necessarily like you're in the dirt like 100 or less, but like if your starting levels were 700, like you're pretty much guaranteed to be at least like maybe a third of that by the time you get to stage.
it. Appreciate it.
Yeah,
And I would
absolutely.
add too, Jacob, like I don't, you know, look, it kind of begs to ask the question, is it quote unquote healthier to do a prep enhanced as opposed to natural? Well, I think if
Yeah.
you had to look at it from both the long term and the short term perspective, probably from a shorter term perspective, probably having some kind of enhancements would help you, right? But if you're somebody who just wants to do a show and then not have to use any kind of exogenous hormones later on in life, obviously not for the long run, right? But if you do use some kind of exogenous hormone, just for the quote unquote prep, and then you have no intentions of running that, after the show kind of thing, it's going to be lower. So like, is it better to prep enhanced? Yes and no. It really just depends on the person and what your goal is, I think. And I think Brennan would probably agree with that as well too.
100%. And even and there's a cumulative effect too of like the exogenous androgen use over time. I see some patients who are very genetically gifted and they can run 50 milligrams of Anavar and it does not touch their cholesterol levels. And then I see somebody take 20 milligrams of Anavar and their HDL, their good cholesterol is cut in half, and their LDL, their bad cholesterol, triples. And so, like in an acute period for like maybe like what the average of 4 to 6 weeks that maybe somebody's running an oral during prep, is that going to have a really significant detriment on your cardiovascular system as far as accumulating what we call atherosclerotic plaques, right, along the cardiovascular system? No, especially if you're young and you've had like very minimal exposure, you're not a smoker, you're not a drinker, like you have very active cardio, you live a healthy lifestyle. But if you don't have those things and then you're doing two preps a year, through 2 to 3 preps a year, and you compound that over 10 years, I mean, I can almost assure you that's going to have a negative impact on your cardiovascular system for sure. And so everybody's different. And that's what I try to always, I see a lot of guys that come to me. Honestly, I see a lot of guys that will come to me because they've been using underground tests for years and they want to do it the right way. And, like part of my thing with, practicing medicine in general, and we used to do this in psychiatry with substance abuse, is we run what's called a harm reduction model. And so, like we don't want people taking drugs that they don't know what they are, right? They don't know the risks involved. They're not monitoring their health. So similar to I used to treat heroin addicts with methadone and Suboxone, right? And those are basically just supplements for another opioid. And so you can kind of think about it similarly in the same way where, you're taking somebody off the street using their underground testosterone, taking, underground exogenous, oral steroids, and, like you're monitoring them appropriately on, like prescribed medications and showing them essentially with the right lab work exactly what they're doing to their body, and preventing them from making any significant long-term risks as much as we can.
Got you.
Yeah.
Appreciate it.
Yeah.
Hey, Brandon, can you hear me?
Yes, sir.
I'm outside. So you said it wouldn't have a significant impact on fat loss, but doesn't it change the way your body digests protein or something having to do with protein synthesis? Can you go into that?
In
And then
regard to
also,
what specifically, Jay, like testosterone use?
right. And
Yes.
then second part of my question. So back in the day, there used to be a lot of talk surrounding creatine in a loading phase. So
Mhm.
I don't really understand that. So like, I've been known to take creatine, 5 or 6 days a week. So I always wonder if I miss that one day, is it really going to have an impact?
A significant effect.
Right.
Yeah. So I'll start with the creatine. So creatine monohydrate, right? One of the most cost effective and well supplemented, like over the counter options for people to increase hypertrophy, hyperplasia, and gain strength. So there's lots of different forms of creatine, right? You also have like nitrate, you have hydrochloride, all these other, you know, shiny options essentially, which really don't have any correlation to improving like effect compared to the monohydrate. But so when it breaks down in the body, like your muscle recognizes it as phosphocreatine, right? And so there used to be like a very big thing on bodybuilding forums, and even I think like some of the bodybuilding magazines, where people would take 15 to 20 grams of creatine monohydrate a day for the first 7 to 10 days and quote unquote load it. And in my experience, and then looking at the literature as well, there's really no reason to actually do that. It just increases your risk for GI upset, but you hit like a threshold essentially after approximately 14 to 20 days anyways of just 5 grams daily. So like you can hit the threshold of like your peak, plasma concentration of what you want for creatine monohydrate within double the amount of time by doing less and causing less GI side effects. Now, if you're taking it every day for a long period of time, they haven't shown any issues with like tolerance or decreased efficacy over chronic use of creatine. Even the studies with people who are in like stage 4 or stage 5 kidney failure or kidney disease, like they really don't show any significant detriment to it, but it's dependent on the individual. If you're taking it 5 to 6 days a week and you miss a day, is that going to make a significant difference as far as what it's doing for you? No, not that I've seen in any literature and not that I've seen for myself subjectively. Um, I don't know what the end measures would be that they would be looking at for that, even if they were to directly like look at it from like a recovery response or a strength response, or I don't know if those studies are out there, but I do know from like the actual plasma concentration, it doesn't change by missing a day. And then go ahead, restate your first question for me with the testosterone as far as the fat loss and protein synthesis. I think I might have lost your audio.
Yep, I see you're unmuted, Jay, but we don't hear anything. I think you said something about I think you said about fat loss as far as does increased testosterone help with fat loss in regards to maybe increased protein synthesis? Maybe I think that's what he said, Jay. Yes, yep, he just put it in the chat. Yes, that's right.
Okay, let me look. So- Okay, all right. All right. So to rephrase that question, so would exogenous testosterone use decrease or increase fat loss due to the elevation in muscle? Like, I assume you mean myops or muscle protein synthesis. I don't know the answer to that question offhand. I'm thinking like in theory, like so they don't understand like because they have had studies done, right, where they will look at testosterone use among untrained individuals and then testosterone levels with trained individuals. So they will supplement testosterone for a period of 12. The study was either 12 or 16 weeks. No, I'm sorry, it was 8 weeks. 8 weeks, they did exogenous testosterone use, 300 milligrams or 600 milligrams, with a control group of the 300 milligrams was training, the 600 milligrams was non-training, and then they had a group where they just trained, and it was just eugonadal states, did not take any exogenous test. And so what they saw was the difference was the same as far as 300 milligrams for the untrained individual compared to the non-testosterone group for the 8 weeks trained. They had the same amount of muscle growth and strength gain over that 8 week time compared to the 600 milligram group did nothing and actually they sat on their butt for the entire 8 weeks and they gained more muscle mass than both groups. So, I say that to say we don't completely understand the mechanism of why testosterone actually increases muscle protein synthesis, and that's probably not the only mechanism in which like it helps with hypertrophy and hyperplasia. Um, I have not seen studies as far as like testosterone's use just like for fat loss itself or how that would. I don't know. I'm trying to think of like a mechanism on the top of my head, of like why, because if you have increased lean body mass, right, then your body is going to, you're burning at a higher metabolic rate than the person who doesn't have lean body, like a same amount of elevated lean body mass. So I think indirectly, if your testosterone is increasing lean body mass, then you're going to have a higher rate of metabolic energy expenditure, and you're going to burn through more, which could end up leaning towards more fat loss. But I don't know if there's studies to equate for that as far as like caloric surplus versus caloric maintenance versus caloric deficit. I definitely don't know the answer to that off the top of my head. I can make it make sense in my head, but that definitely doesn't mean that like there's actual real world data to suggest that that's true.
And I think you could probably add to that too. I was listening to a podcast the other day, and it was kind of along the same lines, but it was more or less like, if we're speaking in terms of like taking exogenous substances to, increase our performance, right? 9 times out of 10, let's take, for example, a time that you're, really, ramping up usage as to like a TRT cruise, right? When you're ramping up the usage and you're taking more exogenous supplements and you're spending more money on, taking exogenous supplements, you're going to be more dialed into your nutrition. You're not going to miss food. You're going to hit your workouts harder. You're going to, get your water intake. You're going to hit your step count. But a lot of times when people turn into that, cruise state to where a lot of the exogenous stuff is lowered down, they don't take it as serious. I guess is maybe the best way to put it. So that it could be a placebo effect that a lot of people are seeing. I mean, because if you're taking a lot of exogenous substances and you know that this stuff is in your system, right? Like, why are you not hitting all of your variables? But if you're on the very low end of using something or not anything at all, that could definitely change your mindset of, I'm in this quote unquote cruise phase. I'm not gonna, cross my T's and dot my I's. I heard that on a podcast 2 days ago, and I was like, that makes a heck of a lot of sense because I've definitely been in that same mindset myself. So,
Yep. Agreed.
but outside of that, that was a great call. I appreciate everybody tuning in. If you guys have any questions for Brandon, interested about anything that he does, I will give you guys his info. You can find him on Instagram, Ascend Health and Wellness. Like I said, I will link all that as well too. And as for anybody who works with me, client wise, and if you reach out to Brandon and you guys start working together, as long as you give Brandon permission to speak to me, me and him can both collaborate, on your stuff as well too, to make sure that you're pretty much kept in line from both ends of the spectrum. So, yeah, outside of that, I appreciate you guys tuning in. We will definitely have Brandon back on sometime in the future. So it was a great call. If anybody's got any kind of questions, just let me know, and I'll drop Brandon's contacts to you guys later on, and we'll talk to you guys soon.